Hi everyone, it's Susan with strokeclass.com. A very common problem after a stroke is the development of abnormal muscle spasticity. So this is when a muscle abnormally tightens due to an imbalance of reflexes that come down from the brain after a stroke. So you might, in the arm, find that the arm is in a flexor pattern, and with the leg, it tends to go into extension. So both of those patterns can really interfere functionally if your arm is kind of stuck in that flexion position or if your leg is kind of stuck in that extension. So people often ask me, what can I do about the muscle spasticity? It's a real problem. So from our therapist's point of view, we know that range of motion is a very important part of managing spasticity. It's one of the tools that we use. So whether it's an auto-assisted where you're helping the arm move, whether someone's helping you with passive range of motion, or you're actively trying to move that limb through range. Stretching is really important. Positioning is also really important. So with the upper extremity, with the arm, you want to try to stay away from that flexor pattern. So as much as possible, you want to maybe be propping that arm out away from your body, maybe on a pillow, trying to keep that hand in an extended position rather than letting it come into a flex position. Sometimes people will see an occupational therapist and get an actual splint made for their hand to keep their hand out in an extended position. Sometimes they'll just wear that splint maybe for resting positions or at night. That's called a resting splint. So positioning is important. The addition of splints may be possible. And then medications are also something that you would talk to your doctor about and see about the benefit that you might be able to achieve from adding a medication into some of the exercises that you're doing the range of motion. Weight bearing is also important because we know that weight bearing through a limb can also reduce some of that abnormal muscle tone. So again, some of the techniques we're using with stroke class emphasize that weight bearing through the leg or through the arm in an attempt to help control some of that abnormal muscle tone. So hopefully these tips will help you as you're dealing, or if you're dealing with muscle spasticity. It can be a problem, but it also is something that can be overcome.
We do a Susan Ealer video, exercise video, at least once a day. It's done on a chair in your home. You don't have to go out.
I mean, I go through, 3 or 4 days of doing the class, and then I'll notice, little incremental improvements. Doesn't change overnight, but it keeps getting better.
Reason for doing this is to get daily exercise, which really I find very, very helpful. So I highly recommend this program to people with strokes.
When rehab ends, where do you turn? And I have an easy answer, and that's Susan Ealer. She takes up where they leave off. And it's absolutely phenomenal what can be gained. Wonderful program.